Hey guys, it's Healthier Shell VSG here, and I'm going to come at you with my 2-week video today. Again, I apologize for doing a vertical video. I still don't have my laptop back from the shop, so I have to make do with what I can, and for whatever reason, I just have a terrible time holding my phone horizontally. So let's jump right in. Today I had my 2-week appointment. I had a vertical sleeve gastrectomy on May 9th with Dr. Aaron Baggs at Kaiser Richmond here in Northern California. So my highest weight on February 27th was 267.2 pounds. My surgery weight on May 19th, 2014 was 236.7 pounds. My weight last week for week 1 was 229.7 pounds. And my weight for today for week 2 was 225.5 pounds. So that is a 4.2 pound loss since last week, which is amazing. That is 11.2 pounds down since surgery and a total of 41.7 pounds down since I started the preoperative nutrition plan. So I am stoked, you guys, like seriously. This week was really weird because my weight did not move at all, did not move at all, did not move at all, went down like 0.2, did not move at all, went down like a pound. And then all of a sudden this morning I woke up and I was down 4 pounds. I do blame that on lady problems, issues. It was Shark Week. And so I don't know what happened, but I am really ecstatic about that. So yay! So this morning I had my 2-week appointment with my surgeon and it went very well for the most part. There was one kind of disappointing thing. So I went in and he thinks that my weight loss is progressing great. He was really excited to hear that I haven't needed any of the pain medicine. I haven't needed any of the nausea medicine. He said my incisions look really good. I can start putting lotion on them, thank God, because they really itch. I had the glue, so I didn't go home with steri strips or anything like that. They basically super glued me. I have one incision that's developed like a little lump on it. He says that's pretty common. It's just my body reacting to the stitch. So he said when I put on the lotion, if I put a little pressure on that, eventually it'll just sort of dissipate and go away. So I'm very excited. He was really excited about how great everything looks and how well I seem to be doing. He was very excited with all of the walking that I've been doing this past week, so that was really good. All in all, very positive appointment. He cleared me to move forward to pureed foods, which I'm super excited about, which I didn't think I would be excited. Remember, I really didn't want purees. I am ready for purees. Get me off these liquids, man. So, that happened. I was excited about that. He was able to move me out of the morbidly obese category into a different category, I guess just obese. I'm not sure what the lower next one down is. I can't remember. And so that was all really positive. He was very excited because I've been getting in all of my vitamins along the schedule as well as my other prescriptions except for the Carafate, which again is that super Pepto-Bismol, like super strength. And the problem is they had instructed me I couldn't drink for an hour before or after I took it, and I was supposed to take it 4 times a day. So I told him I'm either getting in all 4 doses of Carafate and not enough of my liquids, or I'm getting in all of my liquids but not all 4 doses of Carafate. And he said I could disregard what they had told me and in fact could drink right up until when I took it and a half an hour after. And he said if I followed those guidelines, could I do all 4 doses and get my water? And I said absolutely no problem. But the other way, it was eliminating 8 hours of drinking water for me. And he laughed. He said he knew, and they've had that problem before, but I can do it on this other schedule. So I only need to take the Carafate for 2 more weeks, as well as they gave me an antacid that I can stop in 2 weeks, but they give it to you. They give you a 3-month supply, and then it's sort of like you decide if you need it. My sleeve is very talkative and gurgly in the morning when I wake up, which is when I take that antacid, and I swear within 20 minutes of taking it, my sleeve has really calmed down and is doing much better. So I don't know. I might just continue to take it. We'll see how it goes. So that was all very positive. Everything was really good. And then they took my blood pressure. Now, if you've been watching, you know that they pulled me off my blood pressure medicine the day of surgery, and my blood pressure had been stable and everything was great, and even all in the hospital, it was really low and it was really great. Well, today they took it and it was 150/78, and it was so high that I looked at the lady and I was like, can you take that again? Because I do have white coat syndrome, which means they take it, it's high, I wait a couple minutes, I take it again, and it's normal. So she said sure, and she let me wait a few minutes, and then I took it again, and it was 150/77. So that's not good. Generally 120/80 is normal, so 150 is pretty high. So she went and she got my surgeon back, and he called me back into the room, and he said there are a lot of reasons why people's blood pressures might spike after surgery. Your body is out of whack, it's fighting to do all these things, it's relearning all kinds of stuff. There's just a lot of reasons that could cause the up and down, but for now he wants me to get a blood pressure cuff and to take my old blood pressure pill, which is really, it's hydrochlorothiazide, and I take a half a tablet of the lowest strength. It's almost just kind of like a water pill, but he said take it on the days where my blood pressure registers over 120. Sorry, my cats are fighting. So I was kind of disappointed because one of the big reasons I wanted to have the surgery was to get off all this medication. I was really excited when they pulled me off the blood pressure medicine, but he also said with all the walking that I'm doing and losing the weight that I will be losing, he wouldn't be surprised if I didn't need to take it in like a month. He says right now it's probably just my body is reacting to everything that's going on, and it just needs the little extra help. So that's going to happen. I have to keep an eye out for being dizzy and lightheaded and fainting and stuff, because if it gets too low, those are all side effects of that. And he's more concerned that it's going to drop too low when I start taking the pill again than he is concerned about it being high right now, because he says that it's just going to work itself out. So I'm a little bummed about that, but whatever, it is what it is, and it's not forever, it's just for right now. So that was really the only disappointing part of the day. After my appointment, and then one last thing that happened that was really, really interesting was we were in there, and so I asked him, he had cleared me for exercise, he cleared me for everything. He suggests I stay home from work just the rest of this week so that I can get used to eating the pureed foods and stuff in case there's any digestive issues. But and I'm not allowed to walk my dog because he's too big and he pulls on his leash. He's like 85 pounds. But I asked him, finally, I was like, Dr. Bags, you haven't given me a goal weight. What's my goal weight? And he laughed and he said he does not give his patients goal weights, which shocked me because who doesn't give their patient goal weights? And he just said, very matter of fact, that this is a change that I've made and committed myself to, that I'm going to follow the guidelines and I'm going to stick to the plan and I'm going to eat my 3 meals and I'm not going to snack and I'm not going to drink my calories and I'm going to do everything they say and I'm going to lose the weight and my body's going to settle where my body's going to settle. And he said it's hard because people's ultimate goal weight can change based on how old they are, where they started, where their body type, all that stuff. And he doesn't believe in giving his patients a weight to get to, because sometimes they'll get further, sometimes they'll never get there, even if they're doing everything 100% correct. That he just wants you to commit to what you've committed to in having the surgery, and your body will figure it out on its own. So that was really surprising to me, and now I'm not sure what to do. I feel like I need to set my own goal weight, but I don't even know where to begin to do that. I guess I could look at the BMI chart, but I don't know. I've said all along that 160 is pretty much where I would be comfortable at. I know the BMI chart for my height says that is still considered overweight. 160 is about what I was, I guess, maybe like in high school or whatever. I've gotten lower than that, and I didn't care for the way my body looks. I happen to be a lady who likes her curves. I like having boobs and hips and an ass, and I know that they're going to kind of all change and go away a little bit, but I just think at 160 I can maintain some of that, and anything lower, I don't know. But we'll have to see how it goes. It's also, I've never been able to lose weight like this before, so maybe I'll get closer to 160 and decide that I'd rather be less than that. So, I mean, I haven't been 160 in about 1,000,000 years, so who knows? Maybe high school, and my body's different now. I'm 37 years old. It's not the same. It's just not the same, and it's not the same because I'm heavier. It's just not the same because I'm older. So, I'm going to try and think of that and think of some other scales along the way of where to set my goals and different rewards I can give myself and stuff like that. That might be one of my goals for this week. The other goal is Mama Mia, VSG, and we're our sleeve twins. We had surgery the same day, almost at the same time. And we decided that we got frustrated, both of us, this week because of the way that we were not losing. And then it turns out we both ended up kind of being really happy with our weight loss for the week. But what we decided is that we're going to put the scales away for this week. So her husband's going to hide hers, and I'm going to put mine somewhere where I would really have to go out of my way to get it, like the top shelf of my closet or something like that. And we're not going to weigh ourselves all week long until our weigh-in day. Now, I know, for example, my program tells you should get on the scale every day, but I have been going crazy. I mean, I would get up in the morning, weigh myself, go eat breakfast or whatever, drink my tea, go pee, weigh myself, come out an hour later, weigh myself. It was just getting crazy, and I don't want to do that. I think it's healthy to weigh yourself a little bit, a certain, number of times or whatever, but I don't want to be crazy like that on the scale. And it was frustrating me because I wasn't losing, and I kept thinking, I'm not even eating food. I'm just drinking these liquids. How is this possible that I'm not losing any weight? And oh my God. And it started to spiral in my brain. So that's what we've decided to do. And I'm excited to try that and hopefully, not cheat at it, because I am a scale addict, but we'll see. I'm going to put it in the closet right away. So those, I think, are my two goals: try and figure out some reward systems and things along the way, and then to stay off the scale until my next weigh-in. I'm very excited that I get to start the purees today. I had some canned chicken and gravy as soon as I got home. I also bought some canned salmon, some canned tuna. I stuck with the canned meats because they're not as dry, so they're a little easier to puree. I also bought, I did buy some beans because I know a lot of people do the beans. My materials don't say anything about beans at all, which I think is weird. So I might call the nutritionist and see if maybe they're not allowed, or they're just not included, or they included them in with the vegetables or something. I'm not sure. Mashed potatoes are included. They really want you to just do protein, protein, protein. I'm very excited to have some cottage cheese. I'm very excited to have some egg salad. The store was out of the already boiled and peeled for you hard-boiled eggs, so I have to hard-boil some myself. I never quite get it right, but I'm really excited. So everything's going great. My energy has still been really good. I didn't really have any problems last week, other than I did go to that festival on Friday night, and Saturday I was wiped out. My friend invited me to go to a CD release party at the musician's house on Saturday night, and that is the kind of thing I would never miss, and I turned it down because I was just too tired. So yeah, everything's going really well. I've told another friend, and she seemed to take it pretty well. I've popped into work a couple times, even though I'm still technically on leave, and they've all been really excited to see me. I saw my therapist last night for the first time since the week before surgery, and she said that she could visibly see the change in me, which kind of surprised me because I don't really see it at all. But yeah, so I'm just keeping on, and I hope everybody is having a great week, and that's about it for now. I don't really have anything too exciting or anything to share. It's just kind of been a head game. I've had a couple days where I got really frustrated because it's I really want to chew food, but I can't. Memorial Day, I went to a barbecue at my parents' house. My brother and his family were there, and everybody was swimming and everything. And I just left when they threw the food on the grill because I just thought, I don't want to be around for that. Yesterday, I was out with a friend, and she wanted to stop, I guess that was Sunday, and get lunch. And I just kind of told her, I was like, I really don't want to just sit there and watch you eat. Do you mind if we don't do that? And she seemed okay with that. So, there's things to get used to, and it's just a lot of mental struggle. The body stuff is just the body stuff. More than anything, I have to remind myself to eat. I don't really get hungry, although I did have crazy chocolate cravings. Oh, thank God for chocolate pudding, because I ate some of that when I was PMSing. But it's just a mind game. It's just a mind game, and remembering this is all short term. All of this struggle, eventually it's going to come out, and we're going to pretty much be able to eat what we want, and it's going to really be up to us at that point. And I don't know, for me personally, if it's going to be more of a struggle now, trying to get my head around it, and what have I done? I haven't really had that maybe 1 or 2 nights, or I think it's really going to be more of a struggle for me once I am able to eat all of the things, or most of the things or whatever, because then it really is back up to you. And I don't want to fail at this. So for now, I'm sticking 100% to what my surgeon says. I've come to realize all the surgeons are very different. Everybody has different guidelines and things like that. And the only thing I can suggest to everybody, because I see it posted in a Facebook group a lot, can I eat this? Can I eat that? When can I have this? When can I have that? Is just follow exactly what your surgeon says. Your surgeon has their way for doing things. They have their nutritionists. They have their plan. Yeah, I'd really like to have a scrambled egg, and I know a lot of other plans allow them, but my plan doesn't, so I can wait until I get to soft foods to have my scrambled egg. My plan is pretty strict compared to a lot of other plans concerning what I can and can't have. I don't drink protein shakes. We're not allowed, that kind of stuff. But I did get really frustrated with people saying, you should just go ahead and have it and blah, 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 because I don't think that's appropriate advice. The only advice that I would give, I can give recommendations of things that I'm doing, but the only advice I will ever give anybody is to do exactly what your surgeon says. And if your surgeon doesn't send you home with any guidelines or anything, you need to call them and figure out why, or, if they have any or anything like that, or look them up and just choose one, set of guidelines from somewhere and follow them. But I wouldn't try and pick and choose from all the different programs, and I wouldn't try and do something just because the person on that program can do it, even though your program says that you can't. That's just me, and it's not like I'm always going to be perfect, and stick to my plan 100% and all that. I'm not saying that, but I'm 2 weeks out, and I've been seeing people who are 2 weeks, 3 weeks, or a few days out who are completely going against their programs, and it makes me concerned for them, because it's too early to be doing that stuff, so just stick with it. It's hard in the beginning, of course it is, but it's only like a month or 2, and then we'll be back to eating regular food. Yeah, I'm never going to go to a restaurant and have a platter of food again, but who cares? I shouldn't have been eating a platter of food in the first place. So just know, all you pre-op people and you people who are, still in the beginning stages, either right behind me or right along with me, that it's all still early. It's just the beginning, and every day is going to get easier and better from here. So I hope you guys are all having a great one, and just remember, we got to just keep trucking 1 pound at a time. All right, bye you guys, have a good one.